What I remember the most about the nurses is that they're all super sweet and really nice, and also just really supportive of whatever our needs were.
Our experience with the staff was pretty amazing. Birth can sometimes be chaotic and a little scary. There's lots of unknowns, but the way that the nurses handled all Candace's needs and all the things that happen, even the complications, they were super professional.
I think if it hadn't been for Dr. Gard, I think we probably would have, in any other hospital, I think we probably would have been in the operating room. It's a testament to the staff you have here that, they really do look at your birth plan, they talk to you, they get to know you.
During labor, they were all wonderful. After, they were so helpful with helping me figure out how to nurse this little one, and just in all the care they provided. I was really blown away. I was really impressed.
As an attending nurse, the fetal monitor does a lot of things for us. It's essentially the foundation for our care for a labor patient. It allows us to monitor the baby's heart rate as well as monitor contractions.
The fetal monitor guides everything we do. As a mom is in labor, it is telling us for the plan of care what we can do. Can they get off the monitor for a little bit? Is the baby happy?
The fetal monitor lets us watch what's going on with the baby and make sure that there aren't any concerns during labor with the baby's heartbeat. The baby's heartbeat kind of gives us an idea if the baby's under stress during labor.
If we notice that the monitor strip doesn't look really great, we're able to call in backup like respiratory therapy or a pediatrician to be here or another nurse to be here with us.
Oh, there's nothing like hearing the heartbeat. I mean, even from the very beginning, just when you first hear you're pregnant and you hear the heartbeat, but then when you're in labor and it's just a little crazy while you're in labor.
A few times it detected that her heart rate dropped, and so the whole team of nurses came in and they were able to move me around and her heart rate went back up.
Because I wanted to wait and I didn't want to rush her out, it gave me a lot of comfort knowing that it was okay. She was doing fine, her heart rate was right where it needed to be. We didn't need to get her out. It was good. It was very comforting.
The more we got into labor, it just was really kind of uncomfortable. Not the monitor itself, but the band that they had to wrap around it. And so I remember asking if they could remove it, which they couldn't obviously, but they had to kind of cut it a little bit so it wasn't so tight.
We have to have straps around them, but sometimes we have to get them pretty tight to get an accurate reading. For a pregnant mom, that can be uncomfortable.
I watched her struggle with the straps that were on the current monitors that are in use right now. She didn't want anything touching her, whether it was me or tight blankets or obviously the tight straps of the monitor. It was too much for her.
Sometimes I think women feel a little claustrophobic from them or strapped down because we use these belts to keep them in place, and they have wires and they're hooked to a machine.
The cords are sort of tethers. We only can go so far in the room when they're attached to the machine, and that's hard for moms who want to move around and get to the bathroom or to the tub or to the shower.
A few times during labor, once we had everything going, we lost the heartbeat, which always makes you concerned. And then they have to attach you back up and find it again because you want to move around while you're in labor.
Our current fetal monitors have been giving us problems. They haven't been working very well.
They are not able to be fixed because the company's not supporting them anymore.
For the larger patient, who often has to have a staff member there holding the monitor on their abdomen for anywhere from 30 minutes to 2 hours, they can feel very self-conscious about that. Having this ability to have these new wireless devices that sit on their abdomen and not have straps and belts and not have a staff member there, I think it will give them their dignity back.
If my hands are free, then I'm able to provide more of the hands-on nursing comfort care that I would love to give our patients. It makes me excited that maybe these new monitors can help with that.
The new fetal monitor could have really helped through my labor with my desire to be walking around and not to just be on the bed.
The technology has changed a lot since we bought these current monitors. Having a wireless system will get rid of so much of that feeling of being trapped and give women a little more freedom to just move about. I think it's going to be a great thing.